Doctors you can trust.
In this office, we don't have staff, we have family. And that's a big deal. That's a really big deal because the culture in an office can be very critical to the quality of care that's delivered. And so from that aspect, the doctors know better or different than anybody else that's doing a job around here. And so, it's very much a family. We work hard and we have fun, and I think the patient gets a great experience as a result. I got my medical education at Duke University Medical Center. I actually got a partial scholarship while I was there. Following that, went to Vanderbilt University, moved from Durham to Nashville, and spent the next 7 years of my life there, learning how to be an ear, nose, and throat doctor. And during that time, Vanderbilt was building its voice center. So I got to be on the ground floor. I've been a doctor in Atlanta for about 20 years. Over that time, we've built a busy practice in almost all parts of ear, nose, and throat. One of the most interesting things that I do is to take care of folks with voice problems. Professional vocalists or amateur vocalists who might come in and say that they're a bit hoarse, they don't like the sound of their voice, or they have some discomfort when they sing, or they've lost range. When you treat a patient with a voice disorder, you have to think about the medical part. If you discover when you image their vocal cords they have a nodule or a polyp or a cyst, you're certainly going to treat those things. But if that's all you do, you're really only doing half the job. There is a musical part to this that can be as important as the medical part, or potentially even more important than the medical part, because every kind of singing, whether it's singing on stage with a band, singing a Broadway musical, being in a church choir, all of these things have vocal hazards that need to be addressed. Part of what might be affecting your voice is that you work in a place where you're talking to people all day, right? You are a receptionist and you're using that same pair of vocal cords that you got to give the big performance with. So it's really about the whole picture. If they need voice instruction, so many folks that come and sit in this exam chair behind me have never had voice instruction, or they've never seen a vocal studio. And if they need those resources, we have those. We have a speech pathologist that we refer to all the time. We have a Juilliard-trained voice pedagogue, a voice coach who can work on vocal technique issues that can definitely lead to, medically relevant voice problems. If they're an instrumentalist as well as a vocalist and they need a studio to work in, we have that resource available as well. So it's our goal to have a voice center of sorts where all of those things that you might need, we can provide. There's a long history behind the ear, nose, and throat field in the Atlanta market. At ENT of Georgia North, we have the ability to use balloons now, where we can use that technology to open sinuses and allow them to drain much better, and we can do those procedures in the office. I'm Dr. Mike Koriwchak at Ear, Nose, and Throat of Georgia North.
ENT of Georgia North. Doctors you can trust.